Hello, everyone. I'm Kristen. I'm a physical therapist here at Simply Physio, and we would just like to welcome Maritza, our new pelvic floor physical therapist. We're going to start here today by just asking some frequently asked questions. So, Maritza, if you could tell us a little bit more about what the pelvic floor is.
Yes, thank you, Kristen. So the pelvic floor is made up of several muscles and connective tissue that basically support your organs and help with regulating your bowels and your bladder. So when these things when the muscles get out of whack, is when you start to have issues that we need to treat.
Awesome. What conditions do you treat?
A lot of pelvic pain, urinary incontinence, difficulty with bowel movements, pain during intercourse, difficulty during pregnancy or postpartum are the most common ones.
Okay. And do you just treat women or do you treat men's pelvic floors too?
Very good question. So I think that is one of the big misconceptions, is that pelvic floor therapy is only for women. It does tend to be the trend that it is more common to see women with pelvic floor dysfunction, but is not always the case. So I get plenty of male patients.
Awesome. And what should I expect on my first session?
Usually our first visit is used to establish a history, try to figure out where the issues are coming from, and get to know kind of what you've been through and what you need in terms of therapy. So a lot of dialogue, a lot of talking, and then maybe some testing and strength of the pelvic floor muscles. And then we go from there on to treatment.
Okay. So are internal exams required or always needed? And if so, how do you maintain our privacy during that?
Excellent question. Internal exams are a great tool that we have for assessing tissues. So kind of like if you went to a dermatologist, you would want them to look at your skin instead of just feeling through the clothes. It's not always required. There are other ways that we can try to assess that those muscles. So usually we only use them when appropriate, and it's up to patient comfort level. As far as maintaining privacy, we do have private treatment rooms. So you're always one-on-one with the therapist. There are no people around or distractions or people coming in and out. It's all in a private room.
Cool. What if I'm on my period? Am I still allowed to come to a physical therapy session?
So yeah, it doesn't really affect anything that we do. A lot of it depends on patient comfort and how you feel and how severe your symptoms are in terms of menstruation.
Okay. And what is unique about the pelvic floor program at Simply Physio?
I think a great distinction point is our one-on-one treatment model, and then our private rooms that make the very uncomfortable topics that we discuss a lot more comfortable. And then, we do have a specialized, specially trained physical therapist in the pelvic floor.
Do you think you can help me?
Please.
We have had great success with our pelvic floor plan of care. Ultimately, it depends a lot on the individual person and what all is going on. But with most people, we either improve their function or we sometimes eliminate their pain. It just kind of depends on what you're coming in for.
Awesome. And that is all the questions. So if you have any more questions about our pelvic floor therapy program, feel free to give us a call.